Greetings, amazing scholars, and welcome to Learning with Avant-garde Books. I'm Sheree Hardy, your instructor, and I hope you and your family are well. Today's lesson will be about Listeria, a foodborne bacterial illness that can be very serious for certain people in our communities. Before we get started with our lesson, I would like for you to make sure you're in a very comfortable place and you're relaxed so that you can learn more about Listeria. What is Listeria? Listeria infection is a foodborne bacterial illness that can be very serious for pregnant women, people older than 65, and people with weakened immune systems. It's most commonly caused by eating improperly processed deli meats and unpasteurized milk products. Healthy people rarely become ill from Listeria infection, but the disease can be fatal to unborn babies, newborns, and people with weakened immune systems. Prompt antibiotic treatment can help curb the effects of Listeria infection. Listeria bacteria can survive refrigeration and even freezing, so people who are at higher risk of serious infections should avoid eating the types of food most likely to contain Listeria bacteria. What are the symptoms of a Listeria infection? Well, they are fever, chills, muscle aches, nausea, and diarrhea. Symptoms might begin a few days after you've eaten contaminated food, but it can take 30 days or more before the first signs and symptoms of an infection might begin. If the Listeria infection spreads to your nervous system, signs and symptoms can include a headache, stiff neck, confusion or changes in alertness, loss of balance, and convulsions. Here are some of the symptoms during pregnancy, and these are also symptoms in newborns. During pregnancy, a Listeria infection is likely to cause only mild signs and symptoms in the mother. The consequences for the baby, however, can be devastating. The baby can die in the womb or have a serious, life threatening infection within a few days of being born. Signs and symptoms of Listeria infection in a newborn can be subtle, but might include little interest in feeding, irritability, fever, vomiting, and difficulty breathing. When should you see a doctor? If you've eaten a food that's been recalled because of a Listeria outbreak, watch for signs or symptoms of the illness. If you have a fever, muscle aches, nausea, or diarrhea, contact your doctor. The same goes for illness after eating a potentially contaminated product, such as foods made with unpasteurized milk or poorly heated hot dogs or deli meats. If you have a high fever, severe headache, stiff neck, confusion, or sensitivity to light, seek emergency care. These signs and symptoms can indicate bacterial meningitis, a life threatening complication of a Listeria infection. What are some of the causes of a Listeria infection? Listeria bacteria can be found in soil, water, and animal feces. People can get infected by eating the following: raw vegetables that have been contaminated from the soil or from contaminated manure used as fertilizer, contaminated meat, unpasteurized milk or foods made with unpasteurized milk, certain processed foods such as soft cheeses, hot dogs, and deli meats that have been contaminated after processing. Unborn babies can contract a Listeria infection from the mother. What are some risk factors? Pregnant women are much more susceptible to Listeria infections than are other healthy adults. Although a Listeria infection might cause only a mild illness in pregnant women, consequences for their babies can include a miscarriage, stillbirth, premature birth, a potentially fatal infection after birth. People who have weak immune systems should be considered as older than 65, have acquired immunodeficiency syndrome, AIDS, are receiving chemotherapy, have diabetes or kidney disease, take high dose prednisone or certain rheumatoid arthritis drugs, take medications to block rejection of a transplanted organ. Complications. Most Listeria infections are so mild they can go unnoticed. However, in some cases, a Listeria infection can lead to life-threatening complications, including generalized blood infection, inflammation of the membranes and fluid surrounding the brain, meningitis. How can you prevent Listeria? Well, first, keep things clean. Wash your hands thoroughly with warm soapy water before and after handling or preparing food. After cooking, use hot soapy water to wash the utensils, cutting boards, and other food preparation surfaces. Also, scrub raw vegetables. Clean raw vegetables with a scrub brush or vegetable brush under plenty of running water. Cook your food thoroughly. Use a food thermometer to make sure your meat, poultry, and egg dishes are cooked to a safe temperature. Precautions for people that are at risk. If you're pregnant or you have a weak immune system, be particularly cautious about Listeria. Take additional precautions with these types of foods. First, soft cheeses and Mexican style cheeses. Don't eat soft cheeses such as feta, brie, camembert, or blue cheese, or Mexican style cheeses such as queso blanco or queso fresco, unless it's clear from the packaging that the product was made using pasteurized milk. Hot dogs and deli meats avoid unless they're reheated until steaming hot. Keep fluid from hot dog packages away from other foods, utensils, and food preparation services. Wash your hands after handling these products. Don't eat refrigerated meat spreads, canned or shelf stable, meaning they can safely be stored at room temperature. Meat spreads are acceptable. Refrigerate after opening. Smoked seafood. These products can be labeled as Nova style, lox, Kempered, or jerky. It's okay to eat them in cooked dishes. Canned or shelf stable smoked seafood is acceptable. Also, last but not least, raw or lightly cooked sprouts. Cook sprouts of any kind thoroughly. Boys and girls, these are some ways that you can prevent Listeria infection. Brilliant scholars, this concludes our educational lesson on Listeria bacteria. Thank you so much for watching, learning, and listening with Avant-garde Books. For more information about Listeria, you can go to mayoclinic.org. Phenomenal scholars, don't forget to let us know what you've learned. And like this video and subscribe. Thank you so much and continue to shine.